Yeah, my name's Jazz Mattu. I'm a medical herbalist. First of all, I want to thank Strauss Naturals for giving me the opportunity to speak briefly today on behalf of their company and their products. And as Richard mentioned, my background's as a medical herbalist. I've been practicing for about 20-25 years, trained in the UK as a herbalist. I've been fortunate that for a formula like the Strauss heart formula for many, many years, even before I discovered it, I was using very similar formulations in my practice. And when I came to Canada and saw this amazing formula, that was the time when I started telling my patients in my clinic that, you know, there's a great formula out there, we should really look at that. What I want to do today is spend a little bit of time with you and really talk a little bit about two main issues here. And my objective today is really to tell you a little bit about some of the issues that we have facing our country and the people and our health concerns and the problem that we have. And secondly, I want to talk to you about how we as a company feel that we have a solution to that. So that's going to be the essence. If there's any questions, if you could just keep your questions till the end, we'll allow 5 minutes. If we have to get out of here, we'll be outside and I'll be quite happy to stick around and ask any questions if you do so. So let's make a start. So what I'd like to do is start by really telling you a little bit about, you know, the statistics that face us right now here in Canada. As you probably know, as a retailer, 1 in 2 customers that are coming into your store right now are dealing with some form of cardiovascular disease. We're seeing people as young as 20 to 25 years old that are coming in, and they've got some degree of cardiovascular issue going on, whether it's poor circulation, just feeling cold, feeling lethargic, you know, low iron, or whether it's something more severe than that with cardiovascular issues that are going on or circulation issues going on. So 1 in 2 customers are presenting with that, and currently our treatment down here right now, heart disease, the #1 killer in North America. I'm sure you've heard this. The stats are there. In fact, I was just listening to some stats. Even globally, this seems to be the stat, not only here in North America, but even in around the world. What's interesting enough that in my clinical practice, I think you'll all agree that here in BC, we're a fairly healthy province in comparison to some of our neighbors down south or even across Canada. But yet, you know, the stats of 1 in 2 cardiovascular issues still seems to be prevalent, even though the quality of our air is fairly good, our water is relatively good, our food sources are fairly good, we tend to exercise, hiking, skiing, yoga, tai chi. So yet here in BC, if we're seeing those numbers that are still going up and up, it starts becoming a concern as to what's really going on. So we really have to pay attention to what's going on with that. And I will warn you, the next image I'm about to show you is a fairly graphic picture. This picture is really showing someone who's had some infarction there. You can see the damage on the tissue down there. And the reality of this is surgeries like this are taking place every single day. You know, with people that we're seeing sometimes, you know, not necessarily, you know, of an older age, but even younger age. So this is clearly showing that there's some damage to the tissue down here as we go in there. So the reality of it is that we're all facing this. You know, you've heard it being referred to as the silent killer, the first sign, you know, of cardiovascular disease. And sometimes it's unfortunate because our first sign is often our final sign, where we're getting cardiovascular issues. And sometimes it can be a very vague sign, as something as vague as chest pain going on or shortness of breath going on. It's important that we recognize that. And what's surprisingly, I'm sure you probably know, statistically speaking, men are usually more prone to cardiovascular diseases. What we've started to see right now is that women are becoming closer to that same statistics too, especially older post-menopausal women who are at the same sort of risk of cardiovascular disease. So clearly we can see down here, you know, that there are some challenges that are facing us as Canadians. And here's another image down here. This is of a woman that went through the surgery, but as you can see, you know, contracted a drug resistance infection there, which, you know, probably took some healing there. So the reality of it is that's the type of things that we face. And again, another graphic image coming up. If you have a look at this, this is, you know, heart disease, stroke, arterial sclerosis. What you're seeing down there is fat that's coming out of an artery down there. As you can see, a lot of plaque, narrowing our blood vessels, our circulation, and as I'm sure you can appreciate, our bodies are really about our circulation. Circulation is everything. We know circulation is important for our immune system. We know it's important for our nervous system. We know it's important for our digestive system, etc., etc. And when our circulation is compromised, where we're building up plaque, where we're building up blood clots, where we're getting inflammation, that's obviously a problem that's going on. So, strokes, these days there's a lot of talk about the media talking about how much strokes are a concern. The building of plaque again. And what's interesting these days, that even conditions like Huntington's chorea, Parkinson's, dementia, and some of those things that we don't often think as perhaps cardiovascular, they're all about circulation. I think we've got to start realizing that circulation is really, it's everything. So even those types of things are leading to some of these issues that we're seeing down here. Our main objective, our main goal is obviously to stay healthy, prevent any sort of cardiovascular issues going on, prevent premature death, of course, and help us to do what we can with regards to helping our circulation. As a herbalist, when I trained, our first rule was this, and as we took our Hippocratic oath, when we graduated, the first thing was first to do no harm. What can we offer when our customers are coming into the store of what we can do based on what they've got down here. One of the most important products in the store, let's talk about the solution. As I've mentioned a number of times, circulation is everything. Circulation is important for our heart, for our lungs, for our brain, eyesight, kidneys, etc., etc. So it's important that we think about that when we have customers that are coming in. You may get the opportunity to briefly chat with them, ask them what type of issues are going on. For someone who's had a retail store in White Rock, I've certainly been on the same side of the counter as you guys have, and there used to be 3 or 4 questions I would always ask my customers. A, do you have any medical conditions that I need to be aware of before I make any recommendations? B, are you on any medications that I should be aware of? C, do you have any particular allergies or anything that I need to be aware of? And then based on that, perhaps make some recommendations as to what I feel that person needed. But one of the key things is obviously circulation. Anything that we're doing, food that we're consuming, supplements that we're taking, everything requires that to be going in circulation. So that's really, really important in there too. Let's move on and talk a little bit about the Strauss Heartdrops and the Arterial Support Kit. It's been used in herbal medicine to maintain cardiovascular health, reduce cholesterol, lipid levels, hyperlipidemia in adults. For many, many years, many, many centuries, we've known this. We have stacks of information to support empirical evidence and science-based information that's been around for over 300 years. That Strauss have shown to be very, very effective in their formulations. A little bit about our company, Strauss, as you can see from that information there, exclusive manufacturers, sole producers of a formula that's been around for over 300 years and has been producing the Strauss Heartdrops and the Arterial Support Kit. So it's a formula it's not new. It's been around for a number of years, and history, 8th generation family that's been using the formula with the revolutionized garlic age supplement, which is yielding one of the important ingredients, which is your stabilized allicin content in there. It's very, very important that we're aware of that too. And has developed one of the first leading methods in the world with regards to analyzing European mistletoe. We'll talk a little bit more about that in a little while, which is very, very unique herb that's in our product right now. We'll talk a little bit about what it's doing, but there's lots of evidence to support in terms of testimonials and scientific validations with regards to that product. Let's move on and talk a little bit about Heartdrops. I'm sure it's a product that you guys are very, very familiar. You carry it hopefully in your store. This is basically the ingredients that are in there. So as you see down that list, hopefully you recognize some of the names. It's a very simple, synergistic herbal formula with garlic, cayenne, hawthorn, mugwort, willow, bilberry extract, and mistletoe. So let's go through a couple of these just so that you get an appreciation and an understanding as to the sort of synergy of these herbs in there. The first one is garlic, and I think we all know that garlic is usually the number one herb when we think of circulation or we think of heart. We know it's beneficial for a number of different things, our immune system, our digestive system. One of the things that we have is the aged garlic down here. The constituents of it, again, stabilized allicin, and it's important to know that the allicin is an important component. Most of garlic supplementations or garlic products are usually based on their sulfur compounds, but what Strauss have been able to do is get stabilized allicin, which yields the highest mother ingredient in the tincture, and use that in this particular formula. What I've also done is sort of highlighted a little bit with, let me just go back there a little, sorry, highlighted a couple of the different actions down here. And there's many actions of garlic, but what I've done is really emphasize some of the ones that are really important in terms of reducing lipid levels, platelets, even a heavy metal chelator, a powerful antioxidant with that. So listed some of its main sort of medicinal indications or medicinal actions. You know, arteriosclerosis, the hardening of our arteries. Atherosclerosis, meaning that any sort of plaque formation, atheroma, which can lead to a hardening. And then, of course, high blood pressure and peripheral vascular disease. So, herbally speaking, in my clinical practice, if I was looking at these types of things, garlic would be a tincture that I would be looking at, you know, of addressing in a formula or something like this. So we have that in our formulas down here. Another key ingredient down here that we use is cayenne, and cayenne, the main sort of ingredient of that is a product called capsaicin, which is a volatile oil resin. That's a compound that's used. It's got carotenoids in there, powerful antioxidant, and we all know that cayenne helps with the circulation. It gives a nice warming sensation. It's known as a direct stimulant. Cayenne has two sort of different actions. One of the things of it is, does it act as what we call a carrier herb? A carrier herb that it helps to carry some of the other herbs to where they need to go. And often you'll notice that perhaps in sort of arthritic type of formulas, they often have some sort of cayenne in there. And that's because we know that when it comes to bones and joints and muscles and tendons and ligaments, they don't have a good circulation. So often formulas will add cayenne just to help bring circulation to that joint to help heal that. So cayenne's basically doing that, a circulatory stimulant. It's a tonic, it's a rubefacient meaning that it helps to promote heat or circulation to that particular area down there. Very, very effective formula in there. Medicinal actions down here, again, it's indicated circulation again. Circulation in the nerves to help increase the tone of the circulation and increase the force of our pulsation. So when we're feeling our pulse, we know that if we take anything hot and spicy like cayenne, we know that our pulse is probably a little bit stronger than what it was prior to taking it. One of the other ingredients down here is a very, very popular herb known as hawthorn. Hawthorn's packed with compounds that are known as flavonoids, proanthocyanidins, prosanidins, flavonoids, and think of flavonoids as color. Anything that we know, it's recommended that we eat brightly colored fruits and vegetables. Anything that we consume that's brightly colored is probably packed with flavonoids, and those flavonoids have a very, very significant action. One of those actions is as a cardiac inotropic action. What it means by inotropic, it means that it helps to regulate the contraction of the heart. So if we're dealing with elderly people that perhaps have congestive heart failure or a failing heart, poor circulation, low blood pressure, poor circulation, the inotropic action of hawthorn helps to just gently help the force of contraction. And it has what we call an amphoteric action, because you'll see that it says positive. You can have a negative inotropic action too. So the amphoteric action allows that to one of the other actions actually not listed on there is known as a chronotropic action. The chronotropic action of hawthorn is basically about the electrical conduction of that heart. So what hawthorn's doing is communicating with a node known as the SA node or the sinoatrial node. It's the one that's regulating our heartbeat, saying go faster, go slower. So that's one of the other actions that it has. And we don't really need to be concerned that it's going to overexcite the heart, because the beauty about a herb like hawthorn is that it has an amphoteric action. It realizes when the heart needs to go a little bit faster, and when it really needs to slow down a little bit, when it needs to contract a little bit harder, or when it needs to. So that's one of the beauties about it. It has a cardioprotective action, a cardiac restorative, helps again circulation, acts as a vasodilator, so helps to open up those blood vessels, opens them up and allows blood to flow through. So if you ask majority of herbalists what is the number one herb that you think of when you think of cardiovascular diseases or high blood pressure, 99% of people would probably say hawthorn. So it's a great herb to definitely consider. So here's some of the indications. Again, congestive heart failure, arteriosclerosis, arrhythmia. So anyone with those palpitations and stuff like that that's going through tachycardia, we need to be sort of looking at those types of things there. Motherwort is the other ingredient down here, beta-glycosides, a great plant. This one's particularly, it has a cardiac tonic action. It's a bit of a sedative nervine. So if we've got people coming in that are a little bit nervous, anxiety, you know, and my blood pressure goes up when I get nervous or when I get, you know, irritated. And when there's a nervous component to it, motherwort comes in because it's for one of those herbs. So in my clinical practice, if people come in and say, you know, I notice that when I get too excited or when I get anxiety, motherwort would be a great, it has also an antispasmodic action. So if there's some issues with some spasm that's going on, that's what that's particularly going to do. Its indications: infective endocarditis, so any sort of inflammation of the endocardium there, antispasmodic, high blood pressure, peripheral heart disease, the list goes on and on, tachycardia, a fast heart rate, anxiety, those types of things. So these are all important things that this one's indicated for. So as you can see, as we're going through these herbs, a lot of the constituents are playing a key role with regards to some of their effects. Another herb that I'm sure you're familiar with is bilberry. Bilberry extract, flavonoids, again, those brightly colored fruits and vegetables. You know, in this case, you know, bilberries or blueberries, and we know, you know, the importance of those. We see them in a lot of natural healthcare products. We know they're designed, again, for the vascular integrity. So we know that when we take these types of products into our body, they're helping to tone and regulate the capillaries, help with the circulation. So if we're dealing with things even like varicose veins or spider veins or any type of severe, you know, like bruising or something like that, bilberry extract would play a great role because it's a tonic in terms of helping to deal with the vascular content of what's going on. So arterial wall integrity, high blood pressure, you know, oxidized LDLs and stable plaque, these types of indications there. Willow bark. So this particular ingredient has been added in. The salicylates and the phenolic glycosides are the main compounds there. And as you know, or you may know that one of the pharmaceutical drugs like aspirin is actually made from the willow plant. You know, there is some concerns that people may have with regards to, you know, is this aspirin in the formula? It's not. Aspirin is a totally different compound to what's in the white willow, so there's no concerns there. However, being in the same family, it does have that action as an analgesic, an anti-inflammatory, a good tonic in there. And again, it's one of those ones similar to cayenne that helps to push that circulation out there, so it works really, really well. European mistletoe. Main compounds down there is its lectins and its alkaloids down here. This particular herb is very, very specific to our formula, the Strauss Heartdrops down here. It acts as a vasodilator, so again, allows those vessels to open when the blood pressure is high. It will bring that blood pressure down. Anti-tumor effects, immunostimulant, antioxidant. It's the leaves that are of this particular plant that are used extensively. And again, the list down there as you go through that, it has a number of different actions, but it's a very specific action in terms of lowering blood pressure because of that vasodilation, its action there. So good. And then one of the ones that you'll know that we've recently added to a product that we've got right now is cinnamon. So if you've known about the Heartdrops for many years, you know that it's, you know, the original formula didn't have this. And recently what we decided, just to introduce it from a flavor, from a taste point of view, we've added cinnamon in there. Having said that, cinnamon also does have some great medicinal actions that further support our heart drops down here. So down here, again, lowering blood sugar levels, improving lipid levels, peripheral vasodilator, and even as an antimicrobial. I personally take the cinnamon flavor, and if you haven't tried that or you don't have that in your stores, I would highly recommend that you do. And it's a great one. What I'm finding primarily is, you know, you're going to get those customers that are your diehards that have been using Strauss for many, many years, and they just like the garlic and they don't want to change. But we're also getting that generation of people that are coming in that perhaps may not be familiar with the Heartdrops and want to give it a go, but are a little bit nervous about smelling like garlic. So this is where we can really introduce that cinnamon in there and say, hey, here's a great tasting one. So like I said, if you haven't had an opportunity to at least try it and bring it into the store, I would highly recommend, you know, you look at that. So cinnamon's a great one to consider there. Again, it's different actions as what it's indicated for. So as you can see, even as we go through all these different actions and stuff like that, there's a number of different compounds in there that are really covering other bases other than the cardiovascular. What I've done is I've really highlighted, just for the sake of this presentation, primarily those ones that are associated with the cardiovascular system and circulation, but a lot of these herbs will have different ones. Let's move on. So those are primarily the main ingredients from there. Let's move on and talk a little bit about a little bit of history down here and some of the evidence-based science that we've had. And as you know, with Strauss being around for many, many years, we've had the opportunity through thousands and thousands of testimonials that have come in, but also some hard clinical evidence. So where a double-blind placebo-controlled study was done with people with stable angina, and what they were doing, they were given heart drops, and what they evidence showed that when they were taking the heart drops, the cardiovascular markers, which they highlighted as vascular compliance, exercise, lipid levels, inflammatory markers, etc., actually improved and reduced with them taking the formula down here without, you know, affecting their sort of blood chemistry if they were on other medications. So definitely it's a formula that even people that are on medications can safely take down here. Another study down here, which has indicated a 1-year study that was done on volunteers who basically took the recommended dosage, didn't make any changes to their lifestyle that they were doing, and took the formula, and what they found, that the lipid levels that were indicated in risk of the coronary started to improve, started to get better. And again, this is without any sort of, you know, exercise, lifestyle, dietary recommendations, purely based on this is the dosage you need to take, try that. So evidence to support that. So again, you know, some good information down there with regards to that. What I'll do is I'll share with you right now a short video that I'll play for you, which is a testimonial, and there's a bit of an introduction, so I won't go through that. So I'll just play that for you, just for and give you a little bit more of an.
So the provincial act that gives doctors their medical monopoly says only doctors can practice medicine, and practicing medicine includes making treatment claims, and he claimed he could cure heart disease. And he wasn't shy about it. I mean, literally he drove around with a van with big writing on the side, "I cure heart disease." Like there was no way I could go to court and convince a judge that he wasn't guilty of practicing medicine. So I had to, you know, I'm pretty tenacious when it comes to trying to defend people, so I had to come up with some other way. And so what I decided to do was actually ask the court to strike down the law as unconstitutional. Because here we have our Charter of Rights and Freedoms that says we have freedom of expression, and we've got this act saying you can't make a health claim, and the two don't mix. And so I was going to ask the court to strike down the laws violating our right to freedom of expression. And in preparing for that, I wanted to convince the judge that he was telling the truth. And it's not that I even had to do that, because we have freedom of expression to lie, but it's just psychologically, if you're a judge, you're more likely to strike down a law to protect somebody's right to tell the truth. So I asked this herbalist, I said, like, is there any way we can prove that you're telling the truth? Like, at the time, you have to understand, there was no Strauss Herb Company. It was like one shop called Natural Way Herbs. One guy, well, no, Peter was there already, but like, it's Jim Strauss. You were more likely to have tea than buy anything when you walked in there because you'd want to visit. Like, it was really mom and pop shop stuff. There's no way he had a double-blind clinical trial, you know, our gold standard of scientific evidence that's used as a weapon to kill us. So, well, it is. Science has become a weapon. It's supposed to be a tool for discovery, and it's used by a regulatory body as a weapon against us. Because you know what? If you have a serious health condition and the doctors verify it, and then you take a natural health product and you're cured, that's not evidence according to Health Canada. I mean, what do you know? So anyway, I asked this guy, is there anything we can do to prove that you're telling the truth? And he goes into the back and he brings out boxes and boxes and boxes filled with letters. And he goes, here, take this. So I go back to the office and I read all these letters, and they're all literally the same. They're people voluntarily writing in, just saying, I had serious heart disease, I was in bed, I was dying, I took your Heartdrops, I got well, thank you, thank you, thank you, the odd God bless you in there, thank you. Now, I can't enter those letters as evidence. That's called hearsay evidence in court. But I can call the people who wrote the letters to take the stand, take the oath, and tell their story. Health Canada says that's not evidence. In a court, that's the best evidence there is. Okay? Isn't that a disconnect? So, I read through all those letters. I started making calls. I kind of had to figure out, well, who's going to be the best witness? Who's going to stand up on the stand? Who has the best story? And I narrowed it down to 5 middle-class professionals. I deliberately chose middle-class professionals because the courts like them. And they all had the following in common. Well, credibility, right? I need to convince a judge. It's all strategy. But these people had some amazing things in common. They had all had serious heart disease. They had all had at least one open heart bypass surgery. They had all continued to have serious heart disease because the allopathic model was not addressing the cause of the clogging of the arteries. They had all needed another bypass surgery to survive. And here's where they differed, is for some of them, the medical community was not willing to give them another bypass surgery because they were not likely to survive. And for some of them, they weren't willing to go through the process again because they had just found it so awful that they actually would rather die than go through that experience again. They're all at the end of the road with the allopathic medical system, so they turn to the alternative health system. They start taking the Strauss Heartdrops, they all get well. They all go back to work, they hadn't been able to work. And, but there was one side effect, is they were all angry they'd had bypass surgeries in the first place. So just a caution, if anyone takes the Strauss Heartdrops and they've had open heart surgery, you may have a sensation of anger after a while.
Anyway, on to the good news, which is a testimonial for Strauss Heartdrops.
Ooh, good.
This is just one of those things that you will probably get a kick out of, I hope. My husband has been taking Strauss for 3 years. The first year, it was off and on, not steady. For the last 2 years, he's taken it diligently, at least twice a day. He originally had been diagnosed with high cholesterol. His HDL was not good. His LDLs were not good. Everything, all of his numbers were really not good. And the doctor put him on cholesterol medicine, and he was even on blood pressure medicine. Well, I got him started on the Strauss, and after a year and a half, I said to him, I want you to go get checked again, see what your numbers are looking like, because I don't think that you really need all these other drugs if you're doing the Strauss. So let's see what your numbers look like. Well, it came back that his cholesterol had dropped. His blood pressure had normalized. He doesn't need the blood pressure medicine anymore. So
wow.
He stopped taking the blood pressure medicine. He's off the cholesterol medicine. He does have a heart murmur with a leaky valve, and they keep him on amlodipine for that, which I'm not really sure I like that either, but that's the only prescription drug he takes. And he uses that Strauss Heartdrop diligently, twice a day. Recently, the doctor told him he needed a calcium coronary score, and they did this test with an MRI, which I have not heard of before, but it was more effective for them to look at the heart with the MRI. He got his test results back, and his total calcium score is 0.
Oh, my goodness.
I have never heard of anybody having a 0.
Wow.
But it was very funny because it showed right here, it said ranking guide, your score of 0 places you in the 0th percentile rank. That means 100% of the males at the ages from 51 to 55 will have a higher calcium score than you. It is absolutely amazing. He and I were doing high fives when we got this in the mail. We were just doing high fives, high fives. We are not stopping the Strauss, and I would love to encourage other people, if you do have any kind of heart conditions or heart problems, please try the Strauss, because it has done amazing things for him. His heart is healthier than 100% of the other males his age. That is just amazing.
That's great. Well, as you can see, there, those are just a few of the testimonials of many that we get on a regular basis, that we've had for many years. And going back historically, as Sean mentioned, there are piles and piles of testimonials that Strauss have had from success from people that have been taking it and managed to have some amazing things happening with them. So we as a company get to hear a lot about these, and even in my clinical practice, as I'm recommending this product and monitoring these people, by blood pressure and other forms of testing and stuff like that, we're seeing some great results. What I want to move on to next is talk a little bit about our latest product that we've just recently launched. Many of you hopefully know about it and maybe even carrying it in your stores, and if not, then it's definitely one to look at this weekend. It's our Arterial support kit. So this is a product that we've had for just a little while, and it's basically what it is. It's 3 of our bottles of the Strauss Heartdrops that are in a kit, which is a 3-month supply, and based on a minimum of taking for 90 days the recommended doses of 7.5 mils, which that whole kit would last. What we offer is a 90-day money-back guarantee. And what this basically is, that if you have customers that come in and go to their physician and have some of these testing done and get that information and store that information, purchase the product, take this at the recommended dosage for 3 months, and go back and have some of these tests done. And if there's been no improvement in that stage, then we offer a money back guaranteed, and that's at the manufacturer level that we do that. So that's a great combination where for our retailers and your customers that we're able to offer that, and we can do that with confidence. And we've managed to do that really historically, just building all that information through testimonials that we've had, that we're fairly confident, well, not fairly confident, we're very confident that we can see these types of results. So this is something definitely, and again, if you're not that familiar with it, please, do come over to the booth and take a look at this 90-day money back guarantee directly from our manufacturer. So that's really key there. So with our product down there, it's at the moment it's being offered in the cinnamon flavored right now. There is also a significant saving in terms of price when we compare it to 3 standalone large bottles. There's a savings of, I believe, around $100 over the 3 months. So your customers are getting, so especially for those customers that are getting the Strauss Heartdrops on a regular basis, this is something that you may want to offer and say, hey, you know what? Not only is there the 90-day money back guarantee, but you're also saving a little bit of money there too. So I want to finish off with just thanking you all for listening in and getting some information. Hopefully you found it useful. I do want to say one thing, that with this information that I've presented here, it's important to realize that this is really just for information. I'm not here, and Strauss are not about, making medical claims or claiming cures or anything like that. And hopefully you'll appreciate and understand through the history of Strauss and the information that they've had and the problems that we see out here, there's definitely a solution that we have to offer as a company, and hopefully you have to offer as a retailer to your customers. It's a phenomenal product, and if you haven't had the chance again to take a look at it, and during the weekend, I urge you to come out and visit us at our booth there at 302 and take a closer look. A lot of our staff members and staff from our company will be there to answer any questions that you may have. So with that said, I'll sort of open it up for any questions. If people have any questions, I'll be quite happy to answer that. Yes, go ahead.
Can diabetics take this product?
Absolutely, yeah, they can. Yeah, and again, and when I look at it like this, the herbs that we've got indicated in there's nothing that's contraindicated for diabetes. And as you can appreciate, conditions like diabetes and cholesterol and various cardiovascular issues are all sort of interrelated. We know that our kidney and our heart have a direct function, that if our kidneys aren't functioning well, eventually it's going to affect our heart and vice versa. So diabetes, where there's blood sugar imbalances and issues perhaps with, imbalances can definitely affect that. And then again, with the cinnamon, so if you've got customers that have cardiovascular concerns, circulatory concerns, and they're a diabetic, then definitely indicate the cinnamon one, because that's an added benefit to that because of its blood sugar properties. Yeah. Yes, sir.
Any other contraindications with other medications for either blood pressure or cholesterol, even statins or even aspirin?
Good question. Generally speaking, there's not. I mean, the general sort of rule is down here is that when we have customers that are coming in that are on medications, there's only so much that we can do. We have our boundaries of what we could say over the counter. So as patients are coming in, and the general sort of rule of what I will say is what I did in my stories, ask a few questions, establish the degree of what concerns they have. Most of the time, and I'll give you a classic example. If people come in and say, well, I'm on blood thinners, should I be taking this? The first question that I will ask them is how often do you go to the hospital to have something known as your INR test done? And that has to do with blood viscosity. And if they say, never heard of INRs, it's telling me, okay, your blood's probably fine, because if you don't even know what it is, you're probably not going. But if they're saying that we go in on a monthly basis or on every 2 weekly basis, it's telling me that, okay, your blood viscosity is going up and down. So therefore, we're on a bit of a roller coaster. So some caution has to be sort of monitored when we take this. So by all means, take the product. However, we would recommend that, follow up with your physician, with your healthcare practitioner, with your naturopath, as to monitoring your blood pressure and seeing how the medicines are integrated. So with regards to medications that people are on, that certainly it is a formula that can be taken. If there's anything that's really telling you over the counter that someone's coming in with some fairly serious health issues and they're on a big gamut of medications, then I would certainly say it may be best. I can only advise you this much over the counter. I think it's best that with regards to a healthcare practitioner, that you sit down, that someone who knows your history that can guide you through that process. Yeah? All right. Any other questions? No? We're great. Well, once again, I want to thank you. I know it's a beautiful day out there, and we could be out there enjoying 29 degrees temperatures, but you're in here and getting some information, and hopefully you've learned something here today. So I want to thank you guys, and if you're here for the show, please come by and say hi, and enjoy the weekend. Thank you.